Let me introduce Professor Jane Murphy, who's going to talk about understanding preventable malnutrition in the community.
Thank you, Leslie. So, hello everybody. Yes, I'm Jane Murphy, and thank you again, Leslie, for inviting me to speak today. It's a pleasure to join you at this really exciting event. I've just got a sort of few slides to share with you, mostly picking up on some of the things that Leslie has said about conversations about malnutrition, something that is so fundamental when we're trying to pick up some of the signs and symptoms around malnutrition. So a few things I'm going to sort of cover today. Firstly, around how to identify malnutrition and some of the risks, with a key focus on community, because that's where we see a lot of the problems with malnutrition, certainly in older people. Some solutions, how can we go about tackling it? And I'll be sharing with you some really straightforward, easy to use tools that we've developed together collaboratively, can be used by anybody, particularly those in the community, whether you're someone who has malnutrition or whether you're a care worker, a care home staff worker, anybody in the community. And then at the end, if the technology does sort of hang in there, we'll show you a fantastic video and animation that the Malnutrition Task Force has developed. Okay, so I just wanted to start at the beginning, really, to think about this term malnutrition. Well, malnutrition means bad nutrition in principle, and really refers to a problem of not having enough, a deficiency, and actually having sort of too much. But we tend to use this term more to refer to people that aren't having enough good nutrition, or poorly nourished or undernourished. And we do know that malnutrition, undernutrition disproportionately affects too many older adults for some of the reasons that we've heard about already. Malnutrition in older people, as we've heard from Leslie, in terms of its prevalence, well, we quote this 1 in 10 older people living in the community, and that's the majority of older people living with malnutrition that are living in the community. We quote this figure of around sort of 1.3 million older people, those of the age of over 65 years, that because of some of the consequences of the last couple of years and the consequences of COVID-19, as Leslie's alluded to, it's likely that there are many more people, older people, who are affected by malnutrition, poor nutrition, but we can't put an exact figure on that at the moment. It's certainly something that we need to understand much more about. So we see most of the malnutrition in older people in the community, and that's why we really do need to have much more of a focus on the community. But yet we pick that up when people maybe enter a care home or are admitted to hospital as a result of an infection or some other condition, or something else has happened that's affected their health and well-being. And we do know that the majority of older people, as well, we pick them up that have a risk of malnutrition or indeed are malnourished when they're entering care homes or entering hospitals. And we certainly know and understand much more about how malnutrition happens. So on the next slide, you'll see here some of the reasons why malnutrition happens in older people. And I suppose we can sort of break them down into sort of 3 main areas around medical and other disease-related factors, and there's a long list there. I'm sure that there's many more. Physical factors, some of the issues related to memory loss, perhaps people with cognitive problems, people with poor appetite, or as we age may lose that independence to access food, or there may be other sort of physical changes, in particular around dentition. We know that's a big problem. but also as we're becoming increasingly aware of some of the social related issues, and again stressing, you know, the consequences of lockdown, social isolation and loneliness as a result of COVID-19. And as we're moving into winter, some of the winter pressures, and on top of that, the cost of living crisis, I think, you know, in terms of the consequences of these, the impact of malnutrition, we're going to see, you know, much more as we move forward. So a long list of factors there, and that's the point I wanted to make from this slide. Many sort of consequences of malnutrition in older people. But why is it important? Why are we bothered about this? And Leslie's alluded some of this already, and I've already sort of talked about the sort of prevalence of malnutrition. But we do know that if we do something about it, if we do pick this up, if we identify it, particularly at an early stage, the effects are far-reaching. People are less likely to become frail. We see better rates of recovery and improved body functioning as well. Fewer hospital visits and GP visits, so clearly an impact upon how people are accessing health and social care services. Fewer hospital admissions and decreased length of stay if we do pick up the signs of malnutrition early. Increased independence, and also impacts upon the costs associated with malnutrition, which I know are huge and increasing. And we know that if we do manage somebody with malnutrition better, that we do have huge cost savings. The problem is that despite national guidance, and you know, we still have poor detection of malnutrition, and particularly in the community, it remains under-detected, under-resourced, and often overlooked. So why is this? You know, so in thinking about how people view the whole aging process, and when it comes to nutrition, a lot of people perhaps assume that losing weight is an inevitable part of aging. You know, it's simply usual, normal to sort of lose weight as we age, but that clearly isn't the case. And one of the things that we do need to start having many more conversations about is looking and picking up some of the signs and symptoms of certainly unplanned weight loss, and looking at the signs and symptoms of nutrition and hydration, and we'll be hearing a bit more about hydration shortly. But in addition to unplanned weight loss, which may be a consequences of some disease-related problems such as dementia or frailty, there are some key other warning signs, such as if people are not eating for whatever reason at meal times, there may be poor appetite, there may be a loss of interest in food. Leslie talked about how people are accessing activities outside of the home, and perhaps over the last few weeks and months, we've seen more of those activities opening up, but there may be a loss of interest in going out and engaging in some of those activities. There may be signs of irritability, particularly at meal times. Other sort of physical signs of malnutrition, such as pressure sores. You know, pressure sores are, you know, so much related to poor nutrition and poor healing of those wounds as well. Increased number of urinary tract infections, again a consequence of, can be a consequence of poor nutrition and hydration, poor concentration, and perhaps people being unwell for a lot much longer than usual. So some of the sort of key warning signs that we do need to be aware of to really sort of highlight some of the risks and concerns associated with malnutrition. So what can we do? And we've talked about having conversations, and how do we best frame some of those conversations? So what are the tools that we have? And all the tools I'm going to talk about are freely available on the Malnutrition Task Force website, and we'll give you those links at the end. And there's sort of two key tools that I wanted to sort of highlight were, as you can see on this slide here, the Patients Association Nutrition Checklist and the Nutrition Wheel. And what these tools enable anybody to do is to frame a conversation, to ask some simple questions, and to have access, or to have within the tool ways of identifying what that person might need. So first of all, to say, how were these tools developed? Well, they were developed in collaboration with a range of organisations, including Age UK and the Malnutrition Task Force, and a range of stakeholders, care homes, people, older people living with malnutrition, care home staff, and other people who have a key part to play with and working with older people. Previous projects, particularly those undertaken by the Wessex Academic Health Science Network, identified the important role of the wider workforce, volunteers and family carers as well, and they identified the need for simple, straightforward tools to identify malnutrition. And what came through very strongly from that work was to identify malnutrition through a conversation. And that could be done, without the necessity to have maybe weighing scales and those sorts of things, but just through a conversation. So the tools are well tested and were designed to provide early identification of malnutrition, but also to link with other validated nutrition screening tools, such as the Malnutrition Universal Screening Tool, which you might hear about later. But the idea being is with these tools is to pick up the signs and symptoms and to do something in response, to signpost, to help and advice. So how do they work? How do these tools tackle the problem of malnutrition in the community? Well, I can't stress the importance of having an engaging and encouraging a conversation about eating and drinking to raise awareness of undernutrition in later life. They help identify those at risk using these easy-to-use, simple and interactive tools as well. So we've got the Patients Association Nutrition Tech List, which is a checklist, but the other form is the nutrition wheel, which enables much more interactivity around the conversation, which I'll come back to in a moment. And they do provide sort of basic advice about eating well in later life, tailored to suit the needs of the individual, but also other ways to support that individual. And it may not be simply around eating and drinking. It may be other ways to sort of signpost that person, maybe to counselling, maybe to signpost them to their GP, but a way of ensuring that that person gets the help and support that they need. When should these tools be used? Well, they can be used by anybody. They're simple, straightforward, and designed for people who are living in the community, for use in community settings, including community organisations, people working in care homes, and for those working in home and domiciliary care, and other places across the community where older people might be present. Training is not needed, although we have pulled together some really sort of helpful information and guidance on how to use them. So just to say a few more things about the tools themselves. So the Patients Association Nutrition Checklist, developed by the Patients Association in collaboration with other organisations, is a simple tool, a straightforward tool designed to, as I said already, identify malnutrition risk at an early stage. And really the beauty of this tool is that there are 4 key validated questions that focus conversation on unplanned weight loss and nutrition, loss of appetite and interest in eating, and identify the potential risk of undernutrition. And then within the tool, if somebody's identified at risk of malnutrition, a second part which provides information and guidance that might be around basic advice for eating and drinking, or signposting to other venues or other ways of supporting that individual. They're well tested and they've been well piloted in different community settings with older people, with carers, domiciliary care, and working collaboratively with Age UK across England and with GP practices as well. And some of this validated research we sort of published, and there's the link on the slide. So the nutrition wheel essentially incorporates some of those 4 validated key questions. And one of the reasons why the nutrition wheel was developed was to really enable a interactive conversation by using a tool. And essentially it works as a conversation starter. So through a considerable work undertaken notably by the Wessex Academic Health Science Network, the nutrition wheel was launched in September 2019. Alongside the nutrition wheel, there's also a toolkit, an advice sheet, a how-to video, an explanatory guide, and also a nutrition frequently asked question sheet as well. All freely available through the Malnutrition Task Force, and there's the link at the bottom there. So what should you do if somebody is identified at risk of malnutrition, it is indeed undernourished? In terms of providing some basic dietary advice, well, they should be provided with advice around, for example, providing small frequent meals and snacks. Eating their favourite foods. We know that providing older people with their preferred foods, their preferences at any time is really, really important. Milky drinks between meals, and also important that we do stress the importance of high fat milks rather than using sort of lower fat milks. I think it's also important to stress that it's not just about increasing calories and fat, it's also about ensuring that people have that nutrient density as well, because it may be that people can't eat bigger meals as well. So if people are eating smaller meals, it's finding ways to ensure that people are really receiving well-balanced nutrition, so energy and nutrients. And there are various ways that we can achieve that. Alternatively, it may be that the person needs advice to see their GP, go and see their GP, or see a practice nurse or another sort of specialist to discuss maybe some medically related condition. The tools also enable the person to think about maybe some of the other reasons why the person may be undernourished. It may be because of some social related problems. Maybe there's been a bereavement in the family. There may be difficulty getting to the shops. There may be problems with swallowing. All important reasons why that person should seek help and support. Equally, there may be some other actions that are needed in signposting. It may be, if possible, to join a community group, a lunch club, to reduce social isolation if that's a problem. Maybe there may be problems with their dentition. Maybe it's a simple problem as going to see their dentist if that's possible. So I just wanted to sort of highlight a few key tools, and I can't stress the value of this fantastic resource developed by the Malnutrition Task Force, Eating Well in Later Life, and I'm sure you'll hear more about this today, which provides a lot of this information all in one place, freely available and downloadable from the Malnutrition Task Force website. And then on this sort of last slide here, some key links and resources to the Patients Association Nutrition Checklist, the Nutrition Wheel, and some of the resources on the MTF website. So what I finally wanted to do is to show an animation which very nicely shows how these resources can be used, illustrated through some case studies.
We all know that having nutritious and varied food is important for good health and well-being throughout life. But do you know that as we age, it becomes even more important? As life changes, so does our body and health needs. Losing weight unintentionally and getting thinner is not a normal part of getting older. Sometimes weight loss isn't always obvious. You might not notice that your rings are a little bit loose, or your clothes have become too big, or you're not that interested in food. These are all signs that you may not be eating enough to stay well. Barbara's a carer and has noticed that some of her clients seem to be struggling more than usual with eating. She orders a free copy of the Malnutrition Task Force's Guide to Using Tools that will help her start conversations about eating well in later life, a kit that comes straight to her door. Fred has always been independent, but since having some new health issues, he hasn't really felt like going out as much. He's gone off his food, which happens to all of us from time to time. Barbara notices he seems a little low in mood too, and suggests that they have a chat. Together, they run through the questions on the nutrition wheel. It helps them both identify if Fred is at risk of becoming malnourished. Why not try having smaller meals and snacks throughout the day, suggests Barbara. There's really no point in struggling through a bowl of salad if that's all you can eat all day. Fred makes small changes. He feels he's eating better and begins to have a bit more energy, more like himself, and even feels like taking a walk. Gail has always been one for going out and about, but since she's been shielding through COVID-19, she's not that interested in food, feels really tired, and generally can't be bothered. She loves her garden, but doesn't feel like gardening anymore, which makes her really miserable. Together, Barbara and Gail go through the Patients Association nutritional checklist. Barbara suggests, maybe you should treat yourself to a pudding now and again. Buy some full-fat yoghurt and milk. It will help you eat more, but won't make you feel too full. After changing her eating pattern for a couple of weeks, Gail found that she had the energy to get back into her garden doing what she loved. Since Ali's wife died, he's been struggling at home and finds it difficult to think ahead to plan, shop and cook his meals. Lately, he's been having toast for dinner quite a lot, which makes him feel really fed up and a bit of a failure. Barbara and Ali take a look at the MTF booklet, Eating Well in Later Life, for some tips to help. They also check his weight using the Bapen tool. Ali has lost some weight, and so Barbara encourages him to speak to his GP. Ali finds himself more able to plan and cook meals that he enjoys. He's even invited his friends to the park to share a picnic. By making small changes, Fred, Gail and Ali have really improved their appetite, started to enjoy food again and have more energy and enthusiasm for life. You too can become a nutrition superhero. Visit our website www.malnutritiontaskforce.org.uk to find out more about undernutrition in later life and how to request the MTF free toolkit.
Brilliant. Thank you, Leslie, for showing that. It's a fantastic animation. It's just so impactful and says everything in so much better than I can say it anyway, all in one place.
Yes, and that can be downloaded very easily from the website if people want it. Thank you, Jane.
Pleasure.